Fainting during public speaking. The medical word for fainting or passing out is syncope. It is caused by a reduction in the quantity of blood that goes to the brain. It can also occur when your blood pressure drops suddenly. A low heart rate and fluctuating blood volume in different body parts also trigger syncope. If you pass out, you will most likely wake up alive and alert. You may, however, be puzzled by what just happened for a while. This is a common occurrence that affects 3% of men and 3.5% of women. The condition becomes increasingly prevalent as you become older, 6% of those over 75. The illness can, however, afflict anyone at any age with or without any medical issues. Syncopes also comes in a variety of forms, the most prevalent being vasovagal syncope. Gravity causes blood to settle below the diaphragm region of your body. An abrupt drop in blood pressure then leads to less blood to the brain. The second form of syncope is situational syncope. This is when a certain event disrupts the neurological system and causes the fainting, dehydration, fear, anxiety, shock and extended standing. Examples of situational syncope. Extreme levels of emotional stress, hunger, alcohol and drugs can also trigger syncope. The third type of syncope is postural syncope. This occurs when a sudden shift in posture causes an abrupt drop in blood pressure. This could be quickly rising from lying down to standing. Usage of certain drugs and dehydration could also lead to this. The fourth is cardiac syncope. This is when there is a blood vessel or heart problem. This impairs blood flow to the brain and causes syncope. Structural or heart shape issues can also restrict blood flow to the brain. Other causes are blocked arteries, heart valve diseases or blood clots and general heart failure. Let us now look at the symptoms of syncope or fainting. Passing out, feeling dizzy and lightheadedness and falling for no reason are examples. Grogginess, shortness of breath, feeling weak and shaky when standing. Others include a headache, tunnel vision and impaired vision. Patients normally sense the onset of a syncope episode. Lightheadedness, nausea, and heart palpitations are usual warning signs. These are called premonitory symptoms. Here is what to do immediately you feel these warning bells. Immediately sit down or lie down with your legs raised when you sense these symptoms. Syncope can also be a sign of a more serious illness. It is therefore critical to see a doctor after experiencing this. After receiving a correct diagnosis and appropriate therapy, a majority of individuals can avoid difficulties with syncope. We would like to emphasize the importance of seeing your doctor or syncope expert when you have episodes. Your medical history and physical examination come first. Whether you have had some earlier episodes and when is also important. Your doctor might have to perform a few tests to establish the cause of your syncope. These tests include examining your heart health, the heart rate and how much blood it is able to pump to different parts of the body. This is done at various postures, to establish the amount of blood flow at different postures. Here are some therapy options for you. First of all, they are determined by the cause of your syncope. They are also informed by results of your tests and findings of your assessment. Therapy's goal is preventing you from experiencing syncope. Let us now look at some possible treatments and preventive measures of syncope. Taking prescribed medication or changing the existing one. Improve blood circulation by doing yoga or using support garments. You might have to make some dietary adjustments.
9, 10, 8 times.
Consume small, frequent meals. Eat more salt and drink lots of fluids. Avoid caffeine, alcohol and recreational drugs. This has been yet another valuable bite-sized tutorial made with you in mind. We are Animator Academy, your center of solutions to our most pressing self-development issues. Please like this video, subscribe and click the notification bell so as to get more of our videos.